Hi everybody, I'm Dr. Maryam Zamani, and you're watching Harper's Bazaar Arabia Ask the Doctor. So I think that social media has had some benefits to my field of medicine. One is that there's more information readily available, but also on the downside of that is that not everybody who is giving you their expertise are experts in the area. So it's really hard to differentiate what is actually fact and what is basically an influencer giving her opinion. So I think it's really important to know who you're listening to. However, I do think based on social media and having that perfect life and that perfect look, that younger individuals are coming to see us doctors a little bit more frequently and earlier on. So what does that mean? So since the beautiful Bella Hadids and the younger generation of models have come forward with these beautiful chiseled faces, people come in and say, I want that jawline, I want those cheeks, I want those lips. Then when she reversed her lips, having less lips, those types of things. So absolutely, trends in facial contouring are influenced by influential young individuals. Now, the rise that I see is that patients are becoming a little bit more educated earlier on. So they're coming in for prevention, not necessarily to do the treatments, but to try and maintain their skin and their appearance and want to know what they should start doing at a younger age in order to ensure that they look their best for the longest. There are, of course, those individuals who do strive to have an appearance of somebody who they look up to and find aesthetically beautiful. Sometimes I think that's a slippery slope. We have to be the best versions of ourselves, and it's not necessarily in our best interest to try and change ourselves to look like someone else. But of course, I'm there to have little tweakments to make somebody feel and look better. And I think that's what the most important part is that I like to do treatments where I can influence and make better something that somebody else finds that makes them unhappy. So for instance, something simple from having number 11s in between the eyebrow. If that's something that bothers you and makes you feel like you look angry when you look at pictures or makes you look sad even when you're not, then of course I can do a little bit of Botox. Sometimes I might need to do a little bit of filler, but I can improve that, and that can make a big world of difference in how someone feels about themselves. So I think when I see younger patients, I try to steer them in the right direction in terms of what they can do for themselves at home treatments, and then small little treatments that are age appropriate and skin appropriate. So I don't advocate doing things in preventative measures. So if you don't have a problem, don't fix it. So once you have the problem, absolutely we can do something. And if there is something that bothers you and you think that you would benefit from an enhancement, then that's what I'm there for, but not to emulate or to mimic the look of somebody else necessarily. Thanks for watching, and if you have any questions or want to get in contact, please see the link below.